Welcome to Health Planning, an executive discussion series from Abacus Insights focusing on the challenges and opportunities facing payers today in this ever-changing healthcare environment. My name is Minal Patel. I'm very excited to welcome Ruby Kam to our discussion. Ruby currently serves as Executive Vice President and Chief Financial Officer of Blue Cross and Blue Shield of Massachusetts, the largest private insurer in the state and also one of the leading not-for-profit health insurance plans in the Blue Cross and Blue Shield system. In her role, she oversees the underwriting, the actuarial and analytics, risk, and all corporate financial functions with an organization with over $8 billion in revenues and $4 billion in managed assets. Ruby, welcome.
Thanks, Manal. Great to be here.
You know all too well that the function of a CFO in a traditional company is very different than the function of a CFO, the role of the CFO in a health plan. Not only are you managing the corporate functions that the typical CFO would, but you're managing risk. You're pricing and underwriting product to customers. So tell me, how do you think about the role of the CFO and what things you need to be in tune to make you successful in the context of all that diversity?
I think the role of finance is really to bring clarity to any decision or any situation. So what does that really mean? Finance has a seat at the table for decisions and situations, and a lot of it is trying to understand what that means to a company if we're going to do something or not do something. So what is the risk that it creates? What are the dollars that need to be invested? What are the dollars that potentially we could make? And all of that is, I view that clarity or creating clarity as one of the key roles of finance and for me as a CFO.
Data usability is a key need in order to achieve the objectives that a CFO needs to deliver upon, or the entire organization needs to deliver upon. And technology is a huge component of that. And so, what advice would you give to technology organizations as they partner with their CFOs in order to help their CFOs become successful?
So I think the connection between finance and IT has to be so tight in the sense of the finance is a huge consumer of data. And what's super important to us is the consistency and the reliability of that data. And a lot of that is actually built within IT. So it takes this partnership of finance, who's very close to the business, understanding all the data elements, working to define them, explain what we need to run the business and have this lens into the health of the business, and working with IT to actually have IT help us stream for all parts of the business, wherever the analytics is happening. And a lot of it is happening in finance. So it is really just being, arm in arm with IT. And I spent a lot of time with our CIO talking about these things, and our two teams really work very closely together.
As you think about technology and the procurement of technology or almost any other capability, there's always this debate of buy versus build. And often those decisions are made within the business unit or the technology unit that's doing that. But as CFO, I'm sure you get to weigh in and have a perspective on that. So what would you say are some of the guiding principles in that buy versus build question?
So for me, I really look at ROI, and I use ROI just very broadly, and it's not just dollars. When I look at the the return, it is dollars, but it's also, what else are we getting from either building or buying? And in terms of the upkeep of whatever tool we're looking at, and the cost to actually do it, and then the I, and truly understanding the I in terms of investment of speed to market. Is it a distraction for us either to partner or to build? I think that there's value in having reps and having at bats, right? So the way I look at it is that the first time anyone does anything, there's a lot of learning, and there is value of going and finding that entity that has done it multiple times and has done that learning and brings that value to the table for us. And so, I think that fits within the framework of, understanding truly what the return is and what the investment is for us as a company.
As I close this conversation, I want to make an observation for our audience that Blue Cross and Blue Shield of Massachusetts has been a leading innovator in the use of data in addressing very specific issues that matter, health disparities and health equity being amongst the top. You were the first to measure race and ethnicity in determining those health inequalities. And on top of that, put incentives in your provider contracts to try to close them. So congratulations on being an innovator and leading in using data to really make meaningful differences in people's lives.
Thanks, Manal. We're very proud of that work. And in fact, in 2021, we became the first health plan in our market to collect data on racial inequities in healthcare. And in fact, we publish that data every single year. And in 23, we created a pay for equity contracts with providers to governed by the data that we're seeing to look at clinical areas where inequities have been identified, such as colorectal cancer screenings, blood pressure control, diabetes, and child and adolescent well visits.
Ruby, I want to thank you for your time today. I want to thank Blue Cross Blue Shield of Massachusetts for being a phenomenal partner. We appreciate your comments and insights for our audience from the CFO's perspective. And to our listeners, thank you for tuning in. We hope you'll tune in for a future episode of Health Planning, where we get to talk about the challenges and opportunities facing payers today. My name is Minal Patel.